So hi everyone, my name is Connor Hatfield. I'm one of the pre-health peer advisors with the Pre-Health Advising Center on campus. I'm joined today by my coworker, Jacqueline Charbonneau. Jacqueline, if you want to introduce yourself.
Hi everyone. Yeah, like Connor said, my name's Jacqueline and nice to meet you all.
Yeah, so thank you for joining us. And this is the Pre-Health Advising presentation. So hopefully you're in the right breakout room. So Jacqueline and I were the peer advisors for this past academic year. I was a liberal arts and engineering studies major. I'm interested in going to medical school. I graduated this past spring. And Jacqueline?
Yes, so I also graduated this past spring and I majored in bio, and then I was on the pre-optometry route. And then since we both graduated, you will be working with our new peer advisors for this next academic year. And they couldn't make it today, but we'll just do a brief intro for all of them. So we have Lily, Anya, and Gwyneth, and they're all going to be in their fourth year. Lily will be studying biomedical engineering, and she's pre-med. Anya is studying nutrition, also pre-med. And then Gwyneth is bio, and she's also pre-med. But we just want to say that all of them will be trained for all of the careers. So no matter what pre-health career you're interested in, they'll be suited to help you with that.
And so just to go over some of our services that we offer in our office. So we have a pre-health Canvas page, and if you're not familiar with Canvas, you'll become very familiar here in the next few months as you get oriented with campus and your classes. We have a pre-health blog, which is where we post updates about different opportunities that come up as far as clinical experiences, volunteer opportunities, research opportunities, and we'll go into more detail on both that and the Canvas page later on in the presentation. As far as advising services, we assist students with exploring different health-related careers. So a lot of first-year students may know that they want to go into healthcare, but they may not be exactly sure which specific profession. And so that's something that we can help you with. We can help you explore which professions may be a good fit for you based on your personality, your skills, how much schooling you want to go to. And so we can really help you start to narrow down your list of what professions may be a good fit for you based on those qualities. And then prerequisite planning, we can help you based on your major and your profession of interest, plan out what classes you would need outside of your major requirements, health-related community service, research, and leadership experience referrals. So we can help you find opportunities both on and off campus to really expand your extracurricular scope of experiences. And then one-on-one advising and individualized timelines. So essentially what that means is that we can meet with you and help you construct a tentative course schedule for your first year or two, just to help you have an outline of what classes you would need to incorporate into your schedule. And like I said, that would be tentative. It would not be set in stone. With registration, there's always the chance that things don't go as planned, and more often than not, that tends to be how it goes. But this can just serve as a good guide to use as you start planning out your courses at Cal Poly. And then our office does offer lots of pre-health courses. So SCM 101 is our Introduction to Health Professions course. And I highly recommend this for any first-year students. In this class, you have different health professionals from a variety of careers come in and tell you about a day in their life, what their profession's like, their path to the profession, so like what their educational experience was like. And it really just gives you an introduction to a wide range of careers. So in the past, we've had physicians, nurses, physical therapists, dentists, and many others. So for those of you who are unsure or still exploring options, this is a great course for you to take. And then Bio 253, this is our health professions shadowing course. And so this course is open to second-year students and up. So this would not be something you could take during your first year, but it is a great class. You get to shadow a healthcare provider for 7 hours a week. And you can, I believe in the past, we've had physicians, nurses, physician assistants, and maybe a physical therapist. And we're working on expanding the options for students in those classes. And then SCM 363 is a public health internship course. It's called Public Health Fieldwork. And so it's basically a structured internship with the SLO County Health Agency, where you can work on issues like housing and homelessness. And you can work with the needle exchange program, for example. So great hands-on experience for those of you who are interested in public health. And then Bio 301 is our service learning and the health professions course. And this class basically puts you in a community placement doing volunteer work. You'll also be meeting in the classroom to discuss lots of issues related to healthcare that you may not cover in your science courses. So things like the social determinants of health, unconscious bias, and other more social science topics that you may get in a social science class, but are especially pertinent to healthcare. So.
All right, and here's our Cal Poly website. So this is kind of the main hub of a lot of our information, and I won't stress you out with going over all of it, but I'll kind of point out some of the main tabs that I think might be important for starting off as pre-health. So the first one is the contact us one. That's where you can find all of our hours for drop-in and then to make an appointment with us. So the peer advisors, we do drop-in hours, and then as you get further along and start to actually do your application and all of that, then you can meet with a staff advisor to go over the application process and your personal statement as well. And then the careers tab, here's where we list some of the main professions that we advise on. So you can find out more information about the education to get there, what classes you'll need to take at Cal Poly, entrance exams, schools in California, all of the main information you'll need when you're considering that career. And probably the most helpful tab, I would say, is the experiences tab. So we go over all of the main experiences of pre-health, which we'll talk more about in this presentation, but there's just different examples of local opportunities that you can use to fulfill those, as well as just how kind of explaining what each experience would be. And then courses, Connor already talked about the courses we offer, so we just have more info there. And then same with the applying, that will be more pertinent for those of you who are doing the application process, which won't be now, but later on down the road. And then workshops, we have some workshops posted and links to our YouTube from the videos that we've done there. So usually those are more application based, but there may be some on there that are helpful for those starting out. And then the last tab that I would say could be helpful right now is the FAQ tab. Here we just talk about FAQs that kind of are common questions that come up for pre-health students, from starting off as pre-health and picking what track to do, all the way up to the application process and the interviews and all of that.
And this is our pre-health canvas page that we mentioned earlier. So this is basically an extension of our website, and it just has more detailed information on the different professions. It also has some information that's unique to the Canvas page, like sample personal statements from past Cal Poly students that applied to a health professional school. It has interview feedback forms, which I think is probably one of the more helpful resources that we offer on this page. So essentially, students will go to interviews at different programs. So for example, a student who interviewed at UCLA's dentistry program will fill out a form, basically summarizing what their experience was like, in terms of what the interview format was, how long the interview process was, what their general overall experience was like. And so that can give you a great idea of what you'd be going into for that particular interview at that school. And we also have more links to different experiences both on and off campus, so community service, leadership, and research. And so to get access to the Canvas page, all you have to do is email prehealth.calpoly.edu. And I'll put that email in the chat right now. So it's prehealth@calpoly.edu. And you would just include your name, your Cal Poly email address, and you would just say that I would like to be added to the pre-health Canvas page, and then we can get you signed up. So.
All right, and here's Patty pre-health. This is our cheesy way to break down some of the main experiences and the timeline for completing them in terms of pre-health. We will say that when we're talking about timelines, they do differ for everybody just based off of so many different factors. So this is just a general guide, but everyone is on their own timeline and own kind of path here. But the most important thing for starting off is the head, which is the grades. So it's easy to get overwhelmed in the first year or two with trying to, have your application have all these aspects to it, but don't stress out about that too early. Just focus on getting off on the right foot, doing well in classes, and making those connections with professors and then your peers who you're going to have by your side for the next 4 or 5 years, however long it takes. And then once you kind of get your feel for it and start, finding your place at Cal Poly, then that's when we start doing some of the main experiences. So those 4 main experiences that we talk about are health professions experience, which is just like any sort of shadowing, clinical experience, professions that you're going to be doing that are working with patients, community service, which does not have to be health related at all, just any sort of service, because healthcare is such a service-based profession. Research, pretty basic there, and then leadership experience, which we'll also talk about later. And then going further, the entrance exam. So this is one that can vary a lot by whether or not you choose to take a gap year or multiple gap years, or if you're going straight into school after graduation, but typically you take it about spring or summer before applying. But again, we'll help determine your timeline once we meet with you individually. And then after the entrance exam, it comes actual application. So two big components of that are your letters of reference and your personal statement, which is where all these pieces from above come into play in terms of talking about your experiences and reflecting on them in your personal statement, and then having your letter writers be able to talk about you and your character, not just how you did in their class, but who you are. And that's why it's really important to make those connections early on and really apply yourself. And then the last steps here are just the application process itself, and then any interviews you get invited to do. So sometimes that's just one round of interviews, and sometimes it can be multiple rounds depending on the profession and the program that you're applying to.
And so now Jonathan and I are going to go over some of the competencies that health professional schools are looking for in their applicants. So these were developed by the AAMC, which is the central organization for most medical schools in the US. But really these competencies apply to any profession. So whether you plan to be a pharmacist or a dentist or a nurse or a physician, these all across the board apply to any healthcare practitioner. So these first two categories are mostly going to come from your science coursework, or your, not just science, but just your general coursework during your time at Cal Poly. So thinking and reasoning competencies, things like critical thinking, quantitative reasoning, scientific inquiry, and written communication. So critical thinking would maybe come from like a science class, like so in chemistry where you're doing a lab and you have to come up with a synthesis reaction, or quantitative reasoning could be something like calculus or physics, and then written communication from an English class. So you can see there's a bunch of different ways to meet these requirements or metrics. And then science competencies. So there's two categories in here: living systems and human behavior. And so living systems is made up of classes like chemistry, biology, biochemistry, and physics. And then human behavior is more of the social sciences. So things like psychology and sociology. And these are classes that often are overlooked by students, but they're becoming increasingly important for many professional schools, just recognizing how important it is to have an understanding of and an appreciation for human behavior and what drives it. So we encourage you to take classes in the social sciences, not just the core science courses that you expect or plan to take as a pre-health student. So.
All right, and then these next two categories of competencies are a little bit less focused on the academics and the courses, and more focused on just humanistic qualities and things that you'll gain through those experiences that we talked about, and just showing that healthcare really does involve more than just having a high test score or a high GPA, but who you are as a person as well. So starting with interpersonal competencies, a lot of these are like service orientation and ability to work on a team and with people from different backgrounds, so cultural competence, as well as your communication and social skills. So those four main experiences are really going to be where you can showcase your interpersonal skills. And then also when you have your letter of reference writers, hopefully they'll be able to speak to your ability to work on a diverse team and communicate well with those team members and with whoever is, if you have like a faculty advisor or somebody above you who's supervising you. And then for intrapersonal, a lot of these are more about who you are like as yourself. So your reliability, your ability to improve, which again can be shown if you maybe have a little bit of a rocky start in a class or a certain subject, and then you show that improvement in your grades, and then your just desire to do well and to improve yourself. Also, your ethical responsibility to self and others, that's a big one. So a lot of these you can speak to again in those letters, and then also in your personal statement is where you can talk about a lot of these skills, but you don't necessarily state them explicitly, but just by talking about some of the things you've done and what's important to you, they'll shine through still.
Okay, so now we're going to address some myths that are commonly held or believed by some pre-health students coming into Cal Poly or into any college. And the first is that you have to be a science major to go into a health profession. And this is not at all true. While many students are biology and chemistry and biochemistry majors, you can be any major and go into a health profession as long as you complete the prerequisite classes. So you can be a Spanish major, philosophy, business, economics, literally anything, as long as you take those prereq courses. And so we typically advise students to choose a major based on their interests, their aptitude, and keeping alternate career choices in mind. So interests, you want to make sure that you enjoy the topic and it's something that you are passionate about. Aptitude, you want to make sure it's something that you can be successful in and do well in. GPA, as Jacqueline mentioned with pre-health Patty, is very important. And so you want to make sure you can perform well in your courses. And then alternate career choices in mind. So you want to have a career that if for whatever reason you decide not to go into healthcare, you want your major to set you up still for another career that you can be equally excited or passionate about. So that's why we advise students to choose a major that's really true to them and who they are. So you don't have to choose biology just because you want to go into medicine. Schools don't have a preference and they don't favor bio majors. Students from diverse academic backgrounds bring a lot to the table as applicants. So even if you are a Spanish major as a pre-med student or a pre-dental student, there is such a huge need, especially in California, for bilingual healthcare providers, that your background as whether you are a native speaker, just learning more about Spanish, or if you are someone who's learning Spanish in college, that background is going to help you tremendously. So there's definitely not a disadvantage in terms of you being a non-traditional pre-health major. And then one thing to also consider is how you're going to balance your major and prerequisite courses. So some majors do incorporate the prerequisite courses better than others. So things like biology and biochemistry tend to have most of the prerequisites built in. With that being said, you can be a different major and fit in all those classes and still graduate on time. It just may be more difficult for some majors than others. So for example, if you are in mechanical engineering or computer science, where they're already very unit heavy, and there isn't much overlap in the coursework, it may take you more than 4 years to finish everything. So that's just one thing to consider. There's nothing wrong with that. It's very common for students to take more than 4 years, but just something for you to consider in terms of your personal financial situation and your personal timeline. So.
Okay, and before I do the second myth, I see Natalie, you had a question. We are going to save questions until the end and we'll open it up for anyone else to ask questions, but that's a good question and we will answer it at the end of the presentation. So thank you. And the second myth here is becoming a physician, or really whichever career you have your mindset on, is the only career for me. And this is definitely not true, because it's very common for students to change their mind once you come to college, not just pre-health students, but change of major and change of career path is so common because you're just not necessarily exposed to all that's out there just from high school itself. So you meet new people, take new courses, and there's just a lot more to explore. And so that's why our second point here is to explore a variety of careers, just because there's so many out there and a lot of opportunities to match up your own skills and what you want out of a career with a career that will match your, not only what you're good at, but kind of what you're looking for, how much time you want to put in, how long you want to be in school for. So there's a lot more out there than, probably any of us realize, and it continues to expand. And so in pre-health advising, we talk a lot about reflecting on your experiences, and this is something that's definitely very crucial. So when you do something like a shadowing experience, for example, really take the time to reflect on that and see how it impacted you, what you liked about it and what you didn't like, because at the end of the day, if this is going to be your career for the rest of your life, you really want to make sure that it's the right fit. So there's no harm in changing your mind, because now is the time to do it. So just keep your mind open. That's kind of the key of this slide. And so going off of that, here's just some examples of other careers that are out there. And I won't necessarily list them all, but some examples are you could go into podiatry or genetic counseling, chiropractic, naturopathic medicine, forensics, or you can even do more of a health administration side if you want to merge like business with healthcare. So the second website that we have listed here under Explore Health Careers, this is a great one for students to just learn about careers that are out there. I can tell you the first time I visited this website, I knew definitely less than half of the careers on there. So it opened my eyes to a lot of different options and things that can, it's like there is a career for everybody. So sometimes you just have to take the time to explore and to really find the right one. So here's just some examples of those.
And so we want to go back to the conversation about grades that Jacqueline started earlier. And I apologize for harping on this so much, but it really is important for any health profession to make sure that you're academically strong and that you're starting out on the right foot at Cal Poly. So when you come to college, there is a lot to adjust to depending on your unique experience at home or whatever situation you're coming from. For some people, it may be the first time that they are living completely on their own, having to handle laundry and groceries and all those other things that take up more time. And so you not only have coursework that is likely more difficult and faster paced in high school, but you also have additional responsibilities to take care of. So we really just recommend taking the first quarter to focus on grades and to focus on getting adjusted to the pace and difficulty of college. And one thing to note too is that for pre-health students, it's common to only focus on studying all the time. And so while it's important to make sure you have your study habits established and you feel like you have a good idea of how much you need to study, do make sure to occasionally take breaks and go out and meet your people in your dorm, meet people in your building. It's good to establish those support networks early on, especially as you go through the difficult path of being a pre-health student, regardless of what career you're going into. It is a lot of work. And so you want to make sure you have outlets and ways to de-stress, whether that's playing ping pong or just talking with a friend in your building. So studying is super important. And we really want to emphasize doing well in your classes, but make sure you also have some form of balance and that you're taking care of yourself too. And then, so overall and science GPA. So schools will look at your overall cumulative GPA for all of your classes, but they'll also look at your specific science course GPA. So these are things like physics, chemistry, biochemistry. So you want to make sure you pay particular attention to how you're doing in those classes. And then social and behavioral sciences, again, and I believe Natalie brought up a question about this, which we'll definitely go into more detail on here in a little bit, but it is great to get those classes incorporated into your schedule if you can. For some exams like the MCAT, they're covered specifically on there. There's an entire section of the MCAT dedicated to social and behavioral sciences. And it's just very critical to be a great healthcare practitioner. So, and then interact with instructors and faculty. And this is probably the point I would emphasize the most. Going to office hours and interacting with faculty members is one of the best ways to get help in a course, but it's also one of the best ways to get to know professors to where they can maybe provide a letter of recommendation later on. So definitely encourage you to go just for the sake of getting clarification on material. And while you're there, definitely get the help you need, but also just talk to your professor and get to know them as a person. At the end of the day, most professors I'd say if not all of them went into teaching because they love working with students. And so they want to get to know you. They want to know, more than just your questions about their class. And they're always happy to help in whatever way they can. So I encourage you, just spend time with them, get to know them, and develop that friendship over time. And so when the time comes for you to apply, your professors can write letters about you as a person, like Jacqueline was saying, and your personal qualities, and not just how you performed in their class. And then be an engaged participant in your learning. So ask lots of questions. Don't be afraid to, raise your hand in class and seek clarification. Lots of students are confused and have questions early on, especially in college. So don't feel like you're the only one. And really, you're much better off, maybe dealing with that uncomfortableness or that uncertainty of being the one raising your hand, but actually getting the information you need. So don't hesitate to do that. And then healthy exposure. So this is one of the key ways for you to really confirm what health profession is going to be the right fit for you. So really, you don't know what a profession is going to be like until you actually see it and experience it yourself. So lots of students, and this was definitely how I was when I first started exploring healthcare. I had preconceived notions of what healthcare was going to be like and what a typical day was going to be like, and I was wrong in a lot of ways. And so actually getting into clinic and seeing patient interactions can really help you clarify, is this something I want to be doing for the next 30, 40, 50 years? It's also important to do this to show schools that you know what you're getting into professionally. So they want to know that you have a realistic expectation of what the career is going to be like. It's not always heroic. It's not always saving lives. There is a lot of more mundane, simple work that goes into any healthcare position. And so you have to be aware of and willing to do those things. It's not just, saving lives and doing CPR and reviving people. So, and then also be ready to explain the impact that the experience has had for you. Be ready to talk about what patient interactions were meaningful to you, what certain experiences really altered how you view yourself or the health profession that you're considering. Think about how those experiences either confirm that the profession is right for you or maybe point you in a different direction. So we encourage you just to journal on these things after you have the experiences, and also write down things like the provider that you shadowed, how many hours you were there, what your responsibilities were. So if you were shadowing or if you were volunteering, and the contact information for the provider. So things like phone numbers, addresses, email addresses. This is all stuff that you'll need to have when you fill out your application. And so it's much easier to keep track of this as you go along than trying to think back 3 years and dig up all of this information. So, and we do have a log on our website on the experiences tab. We have a template where you can fill out all this info and kind of keep a running log of all that information, and your future self will be very happy you did that if you consistently do it. So I can't recommend that enough.
Okay, and so we have talked quite a bit about the experiences, but we just want to take another minute or so to go over them a little bit more, and then Connor and I are each going to give some of our own experiences that we completed at Cal Poly, just to demonstrate to you all that there are a lot of options, and you don't have to follow some cookie cutter path or do something just because everyone else is doing it, but you can do really anything, and as long as you're checking some of these key boxes here, it'll still work, and being a unique applicant is actually in your favor. So starting off with health related, for me, this was mostly just shadowing. I have work experience, but not until after I did my application and everything. So you don't have to be, doing 20 hours a week in an office, but just really being able to understand the pros and maybe the cons of a certain career and experience that and be able to answer why you still want to go into that career, even knowing some of the maybe not so great parts about it. Community service, tons of options and SLO. I will say that before starting. Some of my two favorites, I guess, would be working with the SLO food bank was always a really fun one and really great to do. And then I also really liked Jack's Helping Hand. They're a nonprofit and they do camps and things like that for kids that are suffering from cancer and for their families, so that the kids can try to live a normal summer camp and be able to have all the support they need for that. For leadership, we both do peer advising, which definitely counts. There's other things that you can do where you can even get paid for your leadership. So you could teach a workshop or a study session. You can also do something like being the captain of a sports team. So there's a lot of options there, and they don't have to be academic, but it can really be any sort of leadership. And research, I wasn't super into the bio research, but I did end up doing a little bit of psychology research, but just one class for a couple units. So nothing too crazy there, just because I couldn't get super into it. So I didn't want to do something just because I thought it would look good. I wanted to do things that I actually wanted to be doing.
Yeah, and so just to kind of go through a few of my experiences. So I was a member of Pulse on campus. So this would fall under the health related experiences tab here. So Pulse is a public health organization on campus that focuses on 4 main topic areas. So there's mental health, physical health, alcohol and substance use, and then safe sex and healthy relationships. So those 4 focus areas each had a team of students that were dedicated to them. And so, for example, I was on the fitness and nutrition team. So we would do presentations on campus and also do one-on-one consultations with students about our respective topics. And so that was an awesome experience. It gives you lots of health promotion and public health preventive experience. Also, that one-on-one interaction with students kind of mimics what healthcare is like, or it could be like depending on your profession. So just kind of a plug for Pulse. I definitely recommend it if any of those areas interest you. And then community service, I also volunteered at the SLO Food Bank. Leadership, like Jacqueline said, we've both been peer advisors, and it can really be any kind of leadership. It doesn't have to be healthcare related. And then research, similar to Jacqueline, I never got super involved into really intensive science research. I did some social science research during my last year. But the main thing we want to focus on this slide is that there is no right or wrong experience. Do something you are curious about. And Jacqueline touched on this towards the end of her talk there. And it's really easy to get caught up in what other students are doing. And your friend may be doing cancer research on campus, or maybe volunteering at a hospital in SLO, and that's great. And that may be a great fit for them, but it might not be a great fit for you. And that's the most important thing, is selecting experiences that are true to who you are and true to what you value as a future provider. So don't sign up for things just to check a box. Don't do research just for the sake of doing research. Make sure you actually want to do those things and that you're going to be passionate about the time you spend there.
So these are the pre-health clubs on campus, and you can see that there are clubs for most of the main professions, but what's awesome is that if you don't see a club for a career or profession that you're interested in, you can always start one. So we definitely encourage students to join these clubs, even if you don't stay in them forever. As a first year, it's very helpful to meet other students who are on the same track as you, so they'll be in your classes with you for the next couple of years probably, so you have some study partners. And then older students who can mentor you through the process. Maybe they're going through the application process now and can give you some tips. And a lot of these clubs will also do different like service events and things like that, or they have leadership opportunities within the club. So definitely don't be shy to join clubs. Even if you join multiple and you're not sure about which profession you want to go into, there's no harm in going to at least learn something during their club meetings.
And then we do have social media for our office. So we have a Snapchat and an Instagram, and we're definitely more active on Instagram. And on these, we'll just be posting information about events that are coming up on campus, different workshops that our office is hosting. If we have any big events or presentations from schools, so if like a medical school is coming to campus or a nursing school, this is all stuff that we'll post on our social media, or even things like job opportunities and community service opportunities. Snapchat, we're working on becoming more active on. That's something that we hope that Anya, Gwyneth, and Lily will tackle next year as our new peer advisors. And so you can either add us by scanning the snap code here, or just add us at cp.prehealth. And if you want to, you can block us on Snapchat so we can't see your story, but I promise you we're not going to watch your story. We have never gone through them in the 3 years that I've been working here. So you have nothing to be concerned about with that.
And here is the website and the QR code to our pre-health blog that Connor mentioned at the very beginning of the presentation. So on the very top corner, you can subscribe. We usually recommend just using your Cal Poly email, and you'll get a daily email with any updates. And this is a great place to find information. We just post all the newest info that we have about any schools or programs that are doing info sessions or workshops or events, any local community service or jobs, research experience, or different things that the clubs and other groups on campus are doing. So just a great way to kind of get your foot in the door, see what's out there, and learn more about some of the different professions.
And the last slide here is our peer advising hours for this summer. So Jacqueline and I are still working for the office through about early to mid-August. And then so you can drop in with us anytime during the hours listed below. So this is our typical schedule. They do change week to week. So I would encourage you to check out our website on Saturday or Sunday just to confirm our hours for the next week. And then the way you find these hours is on the contact us page of our website, and you'll go to the peer advising tab and you'll see the Zoom link there. And then in fall 2021, that's when you'll start meeting with Anya, Gwyneth, and Lily. And so they will likely be doing a hybrid advising model. So tentatively, it would be partly in person, partly virtual. We're not entirely sure what it's going to look like right now, but their hours will be posted later this summer, closer to like the end of August or early September. And on the far right here, we have all of our contact info. So our email, phone, website, and our actual location on campus. So that email address, again, that's the email address to, you can send questions there. You can also email us about the pre-health Canvas page. And then our physical office is in building 53, room 211. And that's the Science North building. And we are not in there this summer, but starting in fall, we will be. So Don't go there quite yet, but in a few months you can. So, but yeah, thank you all for your time and attention. We're happy to take any questions. And we'll definitely, I think we'll start with Natalie's here, but feel free to unmute yourself or send more in the chat if you have any. But Jacqueline, do you want to go ahead and kind of share your experience with social science classes and which ones you took and which ones you liked?
Sure, yeah, I can start and then you can definitely add on any that you took. So some of the main social sciences courses that we recommend, especially for, like, for example, for MCAT prep or just in general, general psych, intro to psych, that's a great one. I took it and I really liked it. I ended up minoring in psych because I enjoyed it so much, but some of the other ones, sociology or anthropology, are two of the other key courses. And that's actually, those are prerequisites for a lot of programs. Like I know for nursing especially, they really value the social sciences. So you can look at the careers tab on our website and see if there are specific prerequisite social science courses required for the career you're interested in. But those are the main three that we would say are helpful in order to prepare. For the question about did I have a certain class that I loved, I think my favorite class I took was health psychology. So, I mean, it was just interesting to me as a pre-health student, obviously, learning about the psychology behind working with patients and also talking about some of the social determinants of health and how health and psychology are really hand in hand. So I really liked that one and would recommend it to anyone who is a pre-health student.
Yeah, I think Jacqueline covered most of it there. I would say definitely general psych, sociology, and anthropology. I also took the general psych course and loved it. As far as another class that may be helpful depending on your profession, abnormal psychology is another great class. That's Psych 405. That was probably my favorite social science course that I took. Either that or this one isn't commonly a prerequisite for programs, but it's just a great social science course for anyone interested in healthcare. It was intercultural communication, Comms 316, hands down one of my favorite classes that I took. So I can't recommend that one enough. But yeah, hopefully that answers your question, Natalie. And if there's any other questions, feel free to drop them in the chat.